We are back here on Girl Talk, which I absolutely love. I'm here with my friend Barb from Coastal Carolina Hospital, Director of Surgical Services. And it actually feels very right for you and I to be talking on a porch on the tidal creek.
Absolutely love it.
It's fantastic, isn't it? You've got a lot to report with Coastal Carolina. You guys are back doing elective surgeries. Talk to me a little bit about what's going on.
Well, the last couple of months have been obviously a strange time and challenging for everyone. We did opt toward the end of May to go ahead and try to resume elective surgeries. It's been a gradual process. We've just really tried to put some safety measures in place, not only to protect our community and the patients that we serve, but also our colleagues and our physicians. So we really have been working hard, just trying to make sure that what we're doing is safe.
So tell me about, let's go through each of those. So when a patient comes in, my dad's had a couple of appointments, and it was like, tell us if you're sick, wear your mask, all of that. What kinds of things should patients expect?
Well, if it's truly elective, what we do is we're asking the physician's office to give us at least a 4-day window so we can reach out to that patient. We are currently testing every patient that is coming in for elective procedures for COVID. And with that being said, that 4-day window allows us to reach out to that patient, get them to come into the hospital or through our drive-through testing area, depending on what they're having done, and we'll actually swab them and hopefully have the results prior to the day of surgery. We really want to make sure that what we're doing is providing safe care for everyone.
Okay.
The more we know, the better. And so,
when someone has elective surgery, it used to be that husband, wives, friends, kids would come and take them in. And is there any protocol around someone who's there to assist, caretaker?
Sure, absolutely. Most recently, we just went back to allowing one visitor per patient. So historically, we've even allowed someone to bring the patient to same-day surgery for their procedure.
Okay.
However, we've highly encouraged them at that time to leave the hospital, go wait in your car, go run some errands. We stay in contact with the family if there's any question or concern about time, but we just want to make sure that what we're doing is safe. So with that being said, we have resumed allowing one family member to come in and be with that patient, and then they can stay in the waiting area. Of course, we're practicing social distancing.
Yes. Mask wearing.
Mask wearing.
And we're not wearing
everyone.
our masks right now because we are about 10 feet apart.
Absolutely. But, otherwise, we're trying to just make the patient feel comfortable and keep everyone safe.
What are some examples of elective surgery? I think a lot of people aren't really clear about that, what that would look like.
Elective surgery is something that you choose to do that's not a medical emergency. It's not urgent or emergent. So that's elective. It can be anything from a colonoscopy
There you go.
for screening. It can be anything from having a lesion removed to having your gallbladder out that's not really bothering you, but it's been there.
Right.
So, but then things do become urgent and emergent, and we treat those as well. And with those, we are doing the rapid testing on those patients. So there's two different type of patients, either outpatient where we have time to test the patient days in advance. And then there's patients that are either in the hospital that require surgery, or they come through our emergency room or our TED, our outpatient emergency room.
Okay.
And so with that being said, we're able to test those patients on the spot and get an active result, whether they're positive or negative for the COVID.
That's
within
pretty
minutes.
Impressive.
Absolutely.
You guys are known at Coastal for a couple of different things. We were just talking before. You've got a fabulous urology.
We do general surgery. GYN is a huge factor for us with our women's center. Urology, again, as you were just talking about, is a huge
Dr.
part.
Gwynn came on, and it was, I didn't realize all the robotics. I know your docs are super credentialed and qualified, but listening to them actually talk about some of the things you guys do surgically are pretty impressive.
Oh yes, the robotics program at Coastal is a huge part of what we do every day, and we are again able to do the urology, general surgery, and GYN, all three of those type of procedures, and just do wonderful work for people. And we do multiple procedures on patients, so the patient doesn't have to come in for each individual procedure. We can do multiple things at one time. And the endoscopy suite, that's another huge factor for Coastal. We have some great physicians at Coastal, and we're truly blessed with what we have.
Well, it's really funny when we're talking about what elective procedures are. I'm thinking elective, I don't know what I was thinking. But elective procedures just means that they're not an emergency. So it could be a hernia or something. Like you said, a colonoscopy. I don't think of those as elective. I think of those as still really important.
Oh, yes. And some things are. Your physician will, work with you to let you know whether or not it's something that needs to be done right away. But if it's something that's just been here or there bothering you, then those become elective. When you're ready to have it done, we're here to help you.
Well, we talked about everybody being a little more cautious now.
Absolutely.
And we talked about what the patients can expect. How about from your physicians, keeping them safe, I think, and the hospital in general has got to be a priority.
Well, no different than the visitors or the patients that we treat. Every colleague, every physician that enters the hospital is screened every day for temperature control. And we just want to make sure that when they enter that they haven't developed any new illnesses, any cough, any fever. So that's every day. And then every employee, every physician, and every visitor, every patient is masked. And so we have the social distancing again. We've really worked to make sure that we have rallied everyone to help with the cleaning of the hospital. We have some wonderful EBS staff, but we have really tried to let them prioritize the cleaning in those high risk areas, patient areas that have the COVID patients, or even our emergency room where we're treating those patients, and again the surgical areas. So everyone is tasked to help clean their own areas, keep things nice, clean, crisp, and make sure that the hand sanitizer is readily available and that all the staff are washing their hands.
It's really amazing to talk to you because I think it just builds confidence in all of us.
Absolutely.
I'm less, it demystifies. It makes me less fearful and more. We've talked to Dr. Suman at the emergency department at the hospital too, and I think I just feel more and more confident, and I would not hesitate to go. I really wouldn't.
I mean, we've got great pre-admission testing nurses, and they're there to walk you through every step of it. So from the time they reach out to you, telling you kind of what you can expect when you walk in, we have a defined entrance that kind of channels all patients and visitors as well as colleagues and physicians through. And again, the whole screening process, making sure that everything we do is safe.
Yay!
And again, the social distancing, we still maintain that, and we want to make sure that everything we do gives the patient confidence when they come in, that we're going to take excellent care of them.
It is wonderful to see you and talk to you, and I just heard a fish jump behind us. I don't know if you, it's like, stay with us. There's a lot more to come on Girl Talk.